So and then try and get some of the answers for it, because they tend to ask these questions a lot. So hello, you welcome to my YouTube channel. Today we are going to discuss some of the questions that have been asked when you are scheduled for your interview for you to come to the UK as a registered nurse. So if you are new to my channel, kindly subscribe and like this page, and I'm happy to have you guys on my channel once again. All right, guys, welcome back. There are several questions that they normally do ask when you are being interviewed by some of these NHS jobs and some of these care homes. So first and foremost, the first question they normally ask is, tell us about yourself. So you need to tell them about yourself. You don't need to speak so much. You just need to tell them, hello, my name is Albert. I am a registered nurse with several years of experience. I work in the NICU. I take care of children who are poorly sick with this and that and that and that kind of conditions. I have worked with the hospital for about so and so years. So you need to tell them about yourself with work related coming into it a bit. You need to ensure that you are using the right grammar as well, you know. Okay, and also they normally do ask about the fact that why do you want to come to the UK and not Canada, why not US, and why UK. So you need to get a good response for them. They normally also ask about the clinical aspects, where they would question you on if in case a patient should fall down, what are your next and things that you would do. So they will ask you this question, so you need to get some of your answers right when it comes to these questions. They tend to ask questions on ABCs as well, so you need to get your ABC intact. They normally ask questions that are relating to relationship that we have with our colleagues at works, so they can talk about conflict. So they can ask you, like, if in case two nurses are fighting on the ward, as a new registered nurse, what are you going to do about it? Are you going to watch them to fight, or you're going to bring them to separate them? What are you going to do? So they normally ask some of these questions. Also, they normally tend to ask questions relating to your workplace. So they would ask you whether you've had an experience that is traumatizing to you, and you want to share your experience with them. So you need to be fluent, you need to be vocal, but remember, you need to listen to the questions they are asking, so that you don't keep on talking and then saying different things. Please try as much as possible to listen attentively to what the panels are asking you, so that you can be able to give them a good response. So some of these NHS do ask that. Some of these care homes also are quite specific, because there are some care homes that deal with dementia patients, so they would ask you questions relating to dementia. Others deal with tracheostomy patients, so they would ask you questions with things relating to tracheostomy. So you need to find out the kind of NHS that it is, where they are located, and then a whole lot of things like that. Please, they would ask you, is there any other questions you want to ask them? Try as much as possible not to ask them about how much they are going to pay you, but ask them about any opportunities they have for career progression. These are some of the questions that they would be expecting from you as well to them. So try and ask them those kind of questions, and I tell you, you would pass with flying colors. They normally ask questions relating to the qualities of a nurse. So you need to tell them about some of the qualities that a nurse should have. A nurse should be smart, a nurse should be compassionate. We have something that we have the 6 C's of nursing in the UK. You need to know this, and sometimes they do ask about it as well. They can ask some of the responsibilities and duties of a registered nurse. They also tend to ask questions about the fact that if in case you are working in acute medical unit and your in charge says you need to move to another ward, how are you going to respond to this? How are you going to behave? You need to try as much as possible to get them a good response as well. Again, they can sometimes ask what are the basic elements of teamwork. So what are the basic elements of teamwork? You need to tell them. So they sometimes can ask about those questions as well. Other times they can ask if you have, they can give scenario questions, like if you have a diabetic patient on the ward who is feeling very anxious and agitated and uncomfortable, and on 2 millimole of insulin, what would be your action as a registered nurse? And how are you going to surgically prepare a patient to the theater? That is, if your job that you are looking for is kind of relating to surgical. So hello there. Try as much as possible to go over this page, this YouTube um, video that I've done. Try as much as possible to listen to the questions that I was putting up, and then try and get some of the answers for it, because they tend to ask these questions a lot. So thank you for watching my YouTube channel. I'm so happy. If you're new to my YouTube page, kindly subscribe, kindly like this page, and then I'll get you more and more and more. Thank you. It's a goodbye for now.